Now this one applies to everybody out there. We all need quality care when it comes to prosthetic devices. Whether you are facing amputation, if you have been an amputee for a short time, or if you're a seasoned veteran who's been around the block for many, many years, this applies to everybody. We all need to seek out and find the best prosthetic care we can. This is our life and we need to live it. You can't be held back by somebody who does not have your best interests in mind. Unfortunately, there are some clinicians out there who are not as good as others. Some excel. You have clinicians who see very active patients, and then you have clinicians on the other end of the spectrum who see lower activity level patients. Basically, what you want to do is find a prosthetist with an experience level and patient load that coincides with your lifestyle so that they can help offer care that's going to best help you out and meet your needs. So it's very important to find that prosthetist. Now, many amputees aren't aware of this, but you don't just have to pick the nearest clinic. I mean, it's obviously more convenient to have the closest to your house, but that doesn't always guarantee the best care. So I myself personally have done this before. We recommend interviewing. There's absolutely no shame or no harm in setting up a consultation appointment to just sit down with a potential prosthetist and ask some questions to sort of feel out who they are as a person, try to gauge their approach to patient care, and get a good feeling if they're going to help you out and give you the sort of care and service you need to succeed. So there's a few questions to keep in mind that you should ask during this type of an interview, and I'll try to go over those questions and why they're important. So if you're a U.S. resident, one of the things you want to ask is, are you ABC certified? If you want to practice here in the United States, you have to be certified. This comes after all the schooling is involved and after completing a residency. Only then are you board eligible and able to apply and test and get your certification. So you're going to want to know if they've done that. If they are not ABC certified and they're trying to practice here in the United States, keep looking. A rule of thumb is if you ask them how long they've been practicing after their residency, 5 years is a good number. In that amount of time, they see a variety of patients with different nuances and have developed a great approach to patient care. So keep that in mind when meeting with a new prosthetist. Another thing you're going to want to ask them is, what is your typical patient load? Some prosthetists tend to deal with the very high-end active patients who have very active lifestyles, and you've got other prosthetists who maybe live in an area with a large elderly population, so they're seeing K2 patients, maybe people who don't have a very active lifestyle. So it's very important to find a prosthetist who works with people like yourself. So keep that in mind as well. And another thing you can do is, if they say, oh, I see active patients all the time, and you want a leg that's going to help you get out there and live your life, you can even ask them, may I speak with a patient? Do you mind? Any good practitioner is going to say, oh, heck yeah, I'll put you in touch. And then you can sort of speak with another patient who has been seeing that prosthetist and get good input. Maybe that's going to help you decide, is this the right clinic for me to be at? Another important question you're going to want to ask is, how many patients of my amputation type do you see or have you seen? Now, we already talked about, you want to see a prosthetist who's got a certain amount of experience, but that is just measured in years. You also want to know about experience with your type of amputation. Now, I'm sure you can find plenty out there who have worked with below knee amputees, many who have worked with above knee amputees, but for those of you who have a more rare type, say a partial foot amputation or a hip disarticulation, hemipelvic, very important to find a prosthetist who has worked with patients of your type of amputation. Ask them how many. You want to know, did they maybe seen 10 patients? It's a good round number. If they've seen 10 patients of your amputation type, you can also ask, what is your success rate? Now, hopefully that won't be offensive, but you do have every right to know what the expectation can be for your outcome. I know that many prosthetists out there will see a patient of a certain amputation and do just fine. However, there are patients of all amputation levels that can be very tricky to fit. Many prosthetists will say, you know, there's been times where I've got a patient who's got me just pulling my hair out, and at that point I pull in another medical professional to help me fit this patient and troubleshoot. There have even been cases I've heard of where a prosthetist has been kind enough to refer you to another clinic to see a professional who specializes in your type of amputation. So please keep those types of questions in mind as well. Let's say everything's looking good. Another thing you might want to ask your new prosthetist is, how available are you? You know, you're going to have appointments and things like that, but is it a matter of, can I call you and, you know, get in there within a day or two if I'm having some sort of an emergency? How accessible are you? Or if I'm having an issue with my socket and I need to see you, is it going to take 2 weeks until you're free and available? So that's something to keep in mind. Also, many practices have multiple prosthetists on site, and it's not uncommon to have your primary guy who you go and see all the time, but there may be somebody else under the same roof, perhaps an assistant or another certified prosthetist, that you can see, you know, in the meantime. If your prosthetist is out of town, maybe you need a little tweak or adjustment, is there somebody there as a backup that you can see? Another good question to ask is, outside of appointment availability, how willing are they to make themselves available outside of normal clinic hours? I know I myself have had great prosthetists in the past who will straight up give you their cell phone number and say, anytime, any reason, you call me. That's a good prosthetist. They truly care about you, and they don't want you sitting on the phone trying to make appointments and waiting long periods of time to come in to resolve a simple issue, when maybe a quick phone call can help get you dialed in. Another important thing to take into consideration is the clinic itself. In fact, you can learn a lot just by looking around at your first impression and saying, well, what's really going on here? Is it a very, very small office? Or do they have multiple fitting rooms? Do they have a gym area with bars? Do they have stairs? Do they have ramps? Basically, is this a place where I'm going to be able to put on my device, walk up and down stairs and see how it works for me? Am I going to be able to walk up and down an incline? Perhaps if you're above knee and you have a microprocessor knee, you're going to need these type of things to truly get the right programming in to your knee so it best functions for you. So keep that in mind. Another thing to pay attention to is, do they do their fabrication in-house, or do they send it out to a central fabrication facility? Now this is kind of important because you might meet an amputee who says, oh yeah, I went in and I got casted and I was there for a couple hours, and by the time I left I was already in my check socket walking out the door. You might meet another amputee who goes in and gets casted and then sent home, and then you come back in a week or two and at that point they have your check socket ready. That's the difference between in-house production versus sending it out to a central fab facility. The timelines change. If you find a prosthetist who does their own in-house fabrication, things are going to move along a lot more quickly. If they do send it out to a central fab facility, doesn't mean the quality of the work won't necessarily be there, but the timeline will be extended because they're going to take your cast, they have to ship it somewhere, you're then at the mercy of the production schedule of the facility you're using, and then you have to wait for it to be returned. Another good reason to find a clinic with their own in-house fabrication is because of modifications and adjustments. The more they have there and in-house, the more they can do for you on the spot. Again, if you have a big clinic that does their own in-house fabrication and you need some tweak made or something like that, typically they can just run into the back into the shop and do what it is they need to do and have you all fixed up. Again, if you have a smaller clinic that doesn't have any of the machinery or a shop type environment to make modifications, you're going to again find yourself at the mercy of timelines while things get shipped out and put into a production schedule and shipped back. So, you know, I'm not saying that you're not going to get great care if they don't do their own fabrication in-house, but there certainly are advantages to it. Other timelines that you want to talk about aside from the fabrication process are the actual fitting appointments, okay? Say you're meeting with them and say they've casted you and your check socket is ready. How long is this appointment going to be? If they say, oh, well, we'll pencil you in for a half an hour, it's probably not going to cut it. A good time to think about is about 2 hours. That gives them time to fit the leg, make sure that you're not having pressure spots. They can make adjustments to it, adjust trim lines, play with your alignment. Basically, you want to allow yourself all the time you can to troubleshoot and get that device dialed in as best as possible. You do not want to rush this process, so keep that in mind. Aside from the actual length of time at the fitting appointment, this is a very important question. Ask them, when I receive my check socket, do you put it on me and then take it for finishing? Or do I get to walk out on this baby and wear it for a few days? That's what you want to do. You can tell a lot at a fitting by, probing and checking for pressure spots and things like that. But in an hour or 2 hours in an office, there's not much that you're going to learn. You need to walk on that device for a few days. Now, a check socket, you don't want to go and try running a marathon on it or anything like that. But it is reinforced, it will not break. As long as you are being smart about things, any prosthetist should give you a good 4 to 5 days to go and really try and use that socket for your daily life. This is where you're really going to identify the problem spots. I hope that makes sense. Imagine putting on a leg and walking in the bars for 15 minutes and saying, okay, great, versus putting on a leg and taking it out into your environment for 5 days. Where do you think you're going to get a better idea of how well that leg is functioning for you? So please ask about that. It's very important. If your prosthetist gives you any reasoning why they will not let you leave with the check socket or wear it for a few days, those are red flags, serious red flags for a numerous bunch of reasons. So keep those questions in mind as well. Another thing to talk to your prosthetist about is, okay, if I come to you for my care, what sort of components are you going to recommend for me? If you're an above knee amputee, ask about what type of knee they prefer to use. Are they skilled when it comes to programming that type of knee? Ask them about the type of foot they would recommend for you. Also ask, if I want to try multiple feet, is that an option? Keep in mind, most components have a 30 to 60 day trial period, so we recommend that you ask many questions about the type of components they're recommending and why, and is it okay for me to do demos. We make prosthetic feet, but we truly feel that you should try a demo just to know, is that truly for you? If you go to a clinic and the prosthetist says, oh, I fit all my patients with product X and product Y, well, that's kind of a weird thing right there. It's like, okay, well, not every patient is the same, so why do you rely on these alone? There's a lot of components available on the market because all amputees are different. So it's very important that you know and understand which components your prosthetist prefers, what your options are, and why. So another thing that you want to ask, are we going to go over my bill? I don't know if you've ever seen one of these before, but if you don't know much about the world of prosthetics and billing and L codes, you can get your bill and not know what the heck's going on. It's like, oh, okay, just sign it because it's scary. Don't do that, don't do that. It's very good to have a prosthetist who will sit down with you and go over that bill line by line, looking at each L code and saying, well, this code right here covers this part of your leg. This code right here covers that part of your leg. This code covers that part of your treatment. Getting a good explanation of exactly what you're being billed for is important. Unfortunately, there are some out there who get very creative with billing, and the insurance company doesn't know any better, so they might throw out a bill with some weird codes on there, and if you don't understand them, it doesn't matter. The insurance company could end up paying, and you're going to end up with a copay on something that you don't know, you don't understand, and you may not have even needed. So very important to ask about billing codes and ask for a explanation of what you are paying for. You have every right to know that. So also, this is huge. Ask your practitioner, at what point in the process do I sign off on this device? Okay? If your practitioner is pushy to, fit you with a check socket as quickly as possible, finish it into a carbon fiber definitive leg, and deliver that and get your signature, that's some red flags. If they take a little time to make sure they're doing the process right, that certainly looks much better for everybody. The bottom line is, once you sign off on your treatment, they then can go ahead and bill your insurance company. At that point, you own that device, and you then become responsible for whatever out-of-pocket or copay you have involved with the leg. So, very important, ask your prosthetist, do I get to sign off when I'm happy with the treatment? Don't take no for an answer. This is very important. It is not until you have a leg you are happy with, that you are comfortable taking home, and you are comfortable paying for, that you should sign off on that treatment. Until then, make them keep working for you. You're the patient. It's not like you need to grow into the socket or make it yourself fit into the socket, right? That's not how it works. A leg should accommodate your needs. So we're going to go ahead and put a little file up on our website that you can all download that will give you a list of questions we recommend you ask your prosthetist. You don't necessarily have to go over this with your prosthetist. Just think of it as a study guide or an educational piece for yourself. The more you know, the easier it will be to navigate this crazy lifestyle. As we've already established, it pays to be your own advocate, so we hope that this information helps you. We'll include a link below, so you may find this on our website. Download it, and hopefully this helps. So once again, thank you everybody for tuning in. Rush Live.